Hello, my name is Peter Lawrence, and I'm pleased to introduce the September issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, and to highlight 4 outstanding papers which are freely available for the next 2 months. The CME article and editor's choice for this issue is entitled Treatment of Superficial Venous Reflux in CEEP6 Patients, a comparison of cyanoacrylate glue and radiofrequency techniques by O'Banion and co-authors. 119 patients were treated, 68 with radiofrequency ablation and 51 with Venous seal. More patients undergoing the RFA technique had a history of deep vein thrombosis and deep venous reflux, and Venous seal patients were older. The median time to wound healing was significantly shorter for Venous seal than it was for RFA. For Venous seal, it was 43 versus RFA of 104 days. The ulcer recurrence rate was 19%, 22 for RFA and 14 for Venous seal. The treatment modality in their study was the only significant predictor of time to wound healing. Our next highlighted article, entitled Endovenous Laser Ablation of Incompetent Great Saphenous Veins with the 1470 nanometer laser using bare tip and radial fibers, have similar short-term outcomes, by Rajendan and co-authors from Calicut, India. They compared pain and outcomes of a 1470 laser using the bare tip or radial fiber in the treatment of incompetent great saphenous veins. 86 patients were randomized. Patients were assessed after the procedures with venous Doppler at 24 hours, 1 week, and 1 month. Pain score at 8 hours and at 1 week were similar with the bare fiber and radial fiber. Improvement in the venous clinical severity score was significant in both groups, but slightly better in the bare fiber group. Both types of fibers had 100% efficacy in terms of closure of the treated vein at 1 month. The third article by Lakhanpal and co-authors is entitled Pelvic Venous Insufficiency Secondary to Iliac Vein Stenosis and Ovarian Vein Reflux Treated with Iliac Vein Stenting Alone. 82 women with pelvic pain and dyspareunia secondary to combined stenosis of the iliac vein and ovarian vein reflux who were treated with stenting alone of the iliac vein were evaluated. At 6 months, 76% reported complete resolution of all symptoms. 93% reported complete resolution of their dyspareunia. 13% reported significant improvement, and 10% reported no improvement. 25 stents were placed in the left common iliac vein, 2 in the right common iliac vein, and 3 placed bilaterally. And 18% of their patients required re-intervention. 76% of the women with pelvic pain secondary to combined iliac vein stenosis and ovarian vein reflux achieved complete symptom resolution with iliac vein stenting alone. The final article highlighted for this issue is Clinical Outcomes of Venous Self-Expanding Stent Placement for Iliofemoral Venous Outflow Obstruction by Zhu and colleagues. 49 patients underwent stent placement with a Zilver-Vena stent for iliofemoral venous obstruction. 19 were diagnosed with acute deep venous thrombosis. 7 presented with non-thrombotic iliac venous lesions, and 2 of the remaining 23 presented with post-thrombotic syndrome. 1 year primary, assisted primary, and secondary patency rates were calculated as 94%, 96%, and 98%. The Volata score and the venous clinical severity score for the post-thrombotic syndrome and non-thrombotic iliac venous lesions were also improved. Venous self-expanding stents offered excellent 1-year patency rates and improve the outcomes of patients with iliofemoral venous obstructions. Thank you for watching. For more information, follow us on social media and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of June. And thank you for your attention.